Today, we're going to demonstrate how one could use manual lymph drainage to treat knee swelling in a massage session. This could be due to injury, surgery, or activities of daily living. Please note that this is an abridged treatment sequence and is not a treatment for lymphedema. We would start with a neck treatment to open the venous angles. Following the neck, we can perform an abdominal treatment and then begin to work on the leg. First thing we'd want to do is to stimulate and activate the inguinal lymph nodes. Working in the femoral triangle, start at the ASIS, making sure the metacarpal phalangeal joint on the pinky is on the ASIS and the hand is in line with the angle of the inguinal ligament. The metacarpal phalangeal joints are going to follow the sartorius muscle. The other hand is going to continue to line up with the muscle. We will then use stationary circles. Stationary circles have two movements, a perpendicular movement to stretch the skin and open the lymph collectors, and a directional movement that deviates toward the regional lymph nodes. The technique is done with the palmar surface of the hand from the metacarpal phalangeal joint out to the fingertips. The palm is not involved. Stationary circles use both hands in the same position. Here we stretch medially and deviate proximally toward the inguinal lymph nodes. We perform this 5 to 7 times. For the second hand placement, we're going to follow the sartorius muscle and move our hands distally and medially. We then perform stationary circles 5 to 7 times, moving our hands medially, then proximally. Here the movement is perpendicular stretch, directional movement. Perpendicular stretch, directional movement. We are going to work on the thigh and we'll show an example of a technique for each area. On the anterior aspect, we will start just proximal to the knee and we will work up to the ASIS. One technique we can do is one-handed stationary circles. We also can combine different techniques for a total of 5 to 7 passes on each area of the thigh. Perpendicular stretch, directional movement. Perpendicular stretch, directional movement. Perpendicular stretch, directional movement. Now we'll show some pumps on the lateral thigh. Our fingers perform the perpendicular stretch to open the collectors, and once the hand is in full contact, it pumps in the direction of the regional lymph nodes. We would perform this 5 to 7 times on the lateral aspect of the thigh. On the medial aspect of the thigh, we are going to show dynamic stationary circles. This is a bimanual technique that uses alternating stationary circles and moves toward the regional lymph nodes. Each area is worked 5 to 7 times. If there's swelling in the knee area, we will work specific to the knee after we've worked the thigh. We can work in 3 hand placements, a pump distal to the knee, on the knee, and just proximal to the knee. Again, this is done 5 to 7 times. We can also work medially and laterally to the knee, simultaneously in 3 places with stationary circles, 5 to 7 times. And that's our short knee demo. Want to learn more? Come learn with us. Join us for a class at acles.com.
So my favorite thing is it was super easy to book, but also you get a home study packet, so I could really soak in the information before I ever got here to the hands-on, and I'm a slow processor, so that was really important for me. The advice I would give someone that is interested in this training is definitely check out ACOLS, and they're very informative, very helpful, and I will say that I'm very interested in the post-op plastic surgery type, but I've learned a lot that there's so many components to it that I'm really going to help a lot of my already existing clients. Thank you so much, and sign up. You'll love it.